Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Monday, May the 3rd for British Columbia. We're honored to be here today on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honored to be here on their lands. Tomorrow, Tuesday, and Wednesday, we'll be giving written briefings at 3 o'clock with updated information about the COVID-19 pandemic in British Columbia. On Thursday, we'll be providing an in-person briefing, Dr. Henry and I, this time from the offices of the Fraser Health Authority in Surrey. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today we're reporting on the 3 periods over this past weekend. Between Friday and Saturday, we had 835 new cases of COVID-19 diagnosed in British Columbia. From Saturday to Sunday, an additional 671 new cases. And in the last 24 hours, an additional 668 people were diagnosed with COVID-19. So that's a total of 2,174 new people diagnosed over the weekend, bringing our total in British Columbia to 131,656 people in our province who have had COVID-19. That includes, over the weekend, 438 people who live in the Vancouver Coastal Health Region, 1,509 people in the Fraser Health Region, 61 people in the Vancouver Island Region, 106 people in the Interior Health Region, and 60 people who live in the Northern Health Region. We currently have 7,327 active cases around the province, of whom 474 are in hospital, 176 people in ICU or critical care. We have an additional 11,781 people who are under active monitoring and 122,518 who have recovered from COVID-19. The 2 outbreaks that we've had at the Prince Rupert Regional Hospital and at Abbotsford Regional Hospital have now been declared over, and we have 1 new outbreak at Lionsgate Hospital. That leaves us with 8 active outbreaks in long-term care, assisted living or independent living, and 3 in acute care. Over this past weekend, we've had 15 more people in British Columbia who've died from COVID-19, bringing the total number of people in BC to 1,596. As always, our condolences and our thoughts are with the families who've lost a loved one over this past weekend, with their care teams in the communities. We know how challenging it is to mourn somebody during these continuing difficult times. Just to put that in a little bit of perspective, the majority of the people, everybody who passed away over the weekend was over the age of 70, with the exception of 1 person who was in their 50s. And most of these deaths occurred in hospitals. As you know, the focus of our vaccine program continues to be to protect as many people as possible, as quickly as possible, to reduce the risk of transmission and the risk of hospitalizations across the province. In addition, we're addressing hotspots and reducing overall transmission. To date, we've delivered 1,877,330 doses of all 3 of the COVID-19 vaccines that are available here in British Columbia. Of those, 91,731 are second doses. Everybody in BC now who's 18 years of age and older is eligible and should be registering on our Get Vaccinated website, or by calling 1-833-838-2323. This is the simplest and most effective way to get your dose of vaccine as soon as possible. Registration is required only once, and I know some people have had some concerns about whether when they receive their vaccine through a workplace program or through a pharmacy program for the AstraZeneca vaccine, do they need to register? And yes, it is helpful to register again, just the once, but if you do register more than once, the system will recognize that as well. Once you are registered, your dose will be reserved for you as soon as the program becomes available, and you'll be notified when to book. This is the most efficient way that we can do this. And appointments, as you know, are now being booked for people, everyone age 54 years of age and older. So if you're older than 54 and you've not yet received a notification to book, make sure you check on whether you've been registered and go online. If you register right away, you will be able to book right away. With more vaccines arriving this week, these appointments will also be speeding up. The most efficient way to get your vaccine, and right now in our age-based program, the basis of our program is the Pfizer and Moderna vaccines that we're receiving in greater and greater quantities in these next few weeks. So register now is important. We have reached a new and encouraging point in this vaccine supply. Starting today, the vaccine that we will be receiving will be increasing significantly. In the month of May alone, we'll be receiving over 1 million doses of vaccine available for people across the province. This is good news for all of us. It means that everybody who is eligible, so right now that's down to age 16, will have access to a vaccine before Canada Day, and we think significantly before that. And that leads us to think about the interval we have between the dose 1 and the dose 2. As you know, the most important thing that we know will help stop transmission and protect everybody is to get as many people as possible their first dose of these vaccines as soon as we can. And with the new increased supply that we have, we are looking at the potential of decreasing the interval to less than 16 weeks for most people. Right now, those people who receive their vaccines early on in the program are getting notified about their second dose, and we've been doing that and will continue to do that as more people get up to that 3 to 4 month mark in the next month. But as we open up immunization to all adults and we get everybody with their first dose, will be able to speed up dose 2 as well. And we're looking at how we can do that in the coming months and weeks ahead. We're moving as quickly as we can to get vaccine into arms and to keep this in step with the supply that we have. The clinics that we've set up are ramping up this week to be able to deliver the vaccines that we expect to receive. But we know that there's been glitches along the way, particularly with our IT system that we've been developing to make sure that we've recorded every dose that everybody has, both for safety reasons and also for your permanent record. In some ways, we've been building a spaceship as we've been flying it, and we're now entering into a new era, a new warp speed, if you will, and there's bound to be bumps along the way. But we will adjust. We know that over the weekend there were some concerns about people registering who'd already received a single dose, and we're getting messages about registering again for their first dose. We will take care of those glitches. There's bound to be more that will arise as well as we're getting more and more vaccines and another 1 million doses into people over these next few weeks. But everybody will get their vaccine and will get their turn, and that turn now is coming soon. I know as well there's some concern about people who've received AstraZeneca and whether there will be second doses of AstraZeneca available for people. We are hearing that, yes, Canada is looking to make sure that we have the supply we need. And we are also watching very carefully what we call the mix and match studies that are going on around the world, particularly in the UK, and we will have more information about that. It may turn out that it is a better, stronger immune response to receive a second dose with a different vaccine. We don't yet know that, but it could be that we'll be able to provide the mRNA vaccines like Pfizer or Moderna as a second dose for people who've received AstraZeneca, or vice versa. So those are the things that we will continue to follow, and when we get that information, we'll provide it to you. So we know that the vaccine is coming in increasing amounts. And when we think about our pandemic and what we are going through right now, what we're seeing is decreasing, slowly but surely, decreasing case rates in our communities. And when we think about how transmission occurs, it's like a path with many, many forks in the road. In some cases, it's one person that transmits to one other person, and that goes on. But in some cases, we know with this virus that it can be a situation where one person transmits to many others. And we know there's certain situations, certain environmental conditions that make that more likely, what we call super spreader events, when one person can affect many people. And that's the way that this virus tends to spread. And that's why we've been focusing so much on reducing those situations where that can occur. That means keeping your numbers small, being outside rather than inside, making sure you're wearing masks and keeping distance when you're inside in particular. We've been on a very steep upward trajectory in our case curve over the last few weeks, and our hospitalizations remain high. And as we know, there are many people right now in critical care and ICU. But there also are some encouraging signs that our efforts are working, that we're starting to come down on the other side of the curve. And as we've seen in places like the UK, the US, once we get down that curve, we can start to see dramatic decreases and more people in our communities protected and preventing transmission. But we need to keep doing the measures that we know worked to prevent us from transmitting to everybody else. What we need to keep doing, it's up to all of us to take those measures to stop the spread. And that means staying local, keeping small, staying away and getting tested if you have any symptoms at all, and getting vaccinated when your turn comes up. And I will also say, reach out to your neighbors, your friends, those you know, to help them get vaccinated as well. We know in some people it's still a very complicated process, and we can all help each other get that process, make it simpler. It's going to be a while before we no longer see new cases, but we need to keep doing our bit to stop those chains of transmission and stop the chance that it's going to spread to large numbers of people. And the things that we are doing are making a difference, and we need to hold the line and keep doing them for the next few weeks. We don't want another upward climb, and we know that that can happen if we take our eye off the end game too soon. So let's continue to do our part to not allow COVID-19 an opportunity to increase anymore. We know that we can do this. We know that these small and large sacrifices that we're making every day are making a difference, and that will save lives. We need to use our collective effort and momentum to keep going now through these next few weeks as more and more vaccines are available. And we need to remember every day that we're getting closer to a time where this pandemic will no longer be controlling our lives, and that we will be able to control this virus. I also want to mention that our Speak survey is still open for another week, and to date about 178,000 people have completed this survey. If you haven't done so, though, please take a few minutes to do that this week. In particular, if you live in some of the more rural or remote areas of the province, if you're a male, if you're over 75, and people from BC's many different ethnic groups, we encourage you to have your voice, to add your voice to this survey so we know how the pandemic and the measures that we've taken have affected you and your communities. And the survey is available on the BC CDC website under COVID-19 survey. Thank you very much, and remember that we will get through this period together. We're making a difference now, and we need to hold that line and remember to continue to be kind and to be calm and to be safe. Thank you.
Thank you very much, Dr. Henry, and on behalf of the Premier, of the government, and of all people in BC, I want to pass on my condolences to the families, the friends, the caregivers of the 15 people who passed away over the last 3 days related to COVID-19 in BC. 9 in the Fraser Health Authority, 1 in the Vancouver Island Health Authority, 5 in the Vancouver Coastal Health Authority. It is a very, very difficult time to grieve It continues to be, especially at this point in this long period of pandemic. And so we want to let all of the families, all of the friends, all the caregivers know that we are with them in this moment and that we grieve with them. As Dr. Henry has said, we have 474 people with COVID-19 in acute care hospitals at the moment, 176 in critical care. And I just want to say that these numbers are still too high, way too high. Both in hospitalization and in ICU, that the pressure on our healthcare system is too high, way too high. The number of postponed surgeries is too high. It's always too high. One postponed surgery is too high, and it's way too high. And the mental and physical toll on the people who care for us is too high. And that's why it's so important when we see those numbers. Even if they're less in terms of hospitalizations than they were Friday, they should inspire us to follow provincial health guidance and provincial health orders. This hospitalization question, the fact that in a number of health authorities we're using our surge beds in ICU in particular, should tell us the need right now, especially right now, to be disciplined and to be in a calm and generous way, but to be disciplined to support our healthcare workers by ensuring that we minimize to the absolute maximum possible degree the transmission of COVID-19 in BC. As Dr. Henry said, 1,785,599 people have received their first dose of a COVID-19 vaccine. That's 41.53% of eligible people in the province. Just to put that in context, with respect to Pfizer, as of yesterday evening, we had used 97% of the available Pfizer. When the Moderna vaccine arrived at the end of last week, the 82,900 doses, we'd used 98% of it, and we've used the vast majority now of the AstraZeneca vaccine in BC. As it's come in, we've used it. But this week and next week and the week after and the week after that, there'll be 276,000 new doses of Pfizer a week each week, and that number will go up in June. Equally, the week after next, we're going to receive more Moderna vaccine. And what that means is that we're in a new phase of our immunization campaign, that the number of people by age and the rapid way that we're going to go through age cohorts is going to continue. And the message from that, the message today, the message for everyone, is that if you have not registered, register. When your turn comes, you'll be invited to book right away. That every time someone gets immunized in BC, it makes every one of us safer. Go to the Get Vaccinated BC website, or alternatively call us at 1-833-838-2323. The immunization campaign to date has focused, because of the supply of vaccines, on those who are most vulnerable. And in fact, almost 85% of people over 70 have been vaccinated. Over 73% of people over 60 have been vaccinated, as have more than 190,000 people who are clinically vulnerable. And immunization clinics have been held in all 205 of our Indigenous communities that were targeted for specific immunization clinics. In addition, all Indigenous people are eligible to both book and to register and to book their vaccine at this time. So I want to encourage everyone in our fight with COVID-19. We can't have one foot on the gas and one foot on the brake. Fighting COVID-19 is an all-in undertaking. Any pause in our efforts, any hesitation in our action, any delay in doing what we know is right, fuels a virus that lives to spread and spreads to live. The message from COVID-19 numbers from the last 3 days is this: keep using our skills to stop the spread. Keep following the guidance that we've been given to keep us safe, and keep adhering to the public health orders that underpin our fight. Keep living in the present, right now, this moment, this present, and make each one of those moments one where we know our actions have stopped the spread. And if you have not registered, register for your vaccine. And if you have the opportunity and you're invited to book, please book. As I say, that will make us safer. It's 41.53% of eligible people now, but we are going to make significant advances in immunizations, but it depends on all of us. I think our staff who are doing the immunization are going all out, are doing everything they can, and we need everyone to join us in this effort. Register, register, register. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune. soit celle du 30 avril et 1er mai, celle du 1er mai et 2 mai, et celle de 2 jusqu'au 3 mai en mi-journée. Il y a eu 15 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 1596 personnes décédées de COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 835 nouveaux cas. Pour la deuxième période de référence, nous avons eu 671 nouveaux cas. Au cours des dernières 24 heures, 668 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 474 personnes sont actuellement hospitalisées, dont 176 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
As a reminder to reporters on the phone, please press *1 to enter the queue. You will be limited to one question and one follow-up. Please also remember to take your phone off mute, as you will not be audible until your name is called. Our first question today is from Katie DeRosa, Vancouver Sun. Please go ahead.
Hi, Dr. Henry. I'm wondering about some areas of Surrey that are persistently seeing higher cases, and some of them that are struggling with the vaccination uptake, as you mentioned on Thursday, perhaps not registering. Or what are we seeing in terms of, again, this? Is it vaccine hesitancy? Is it communities that are not getting the proper information to go to certain clinics? And what's the strategy in going forward, since the pop-ups had some of their challenges? What will be the strategy to getting those communities vaccinated as fast as possible?
Yeah, so we've been looking into that, obviously, with Fraser Health and with our team provincially, and it's a combination of a lot of things. We know that one of the reasons why case rates are quite high is because many people in communities in and around Surrey are essential workers, people who must go into work, whether it's childcare or healthcare or working in grocery stores or in food production. So we know there's a lot of that. We also know that there are many people who live in large multi-generational families, and where transmission can go quite widely in families, and that there are some barriers around language, and that we need to continue to reach out through community groups to make sure that we have the right information that people need to make the right choices at the right time. So all of those things are things we're looking at. I know on the weekend, for example, Fraser Health teams were out in a number of the gurdwaras in around Surrey to support people and answer their questions about immunization, make sure they knew where the clinics were and how to get registered. And there's a number of different strategies that we're working on in many communities to try and increase awareness. And it's not just in Surrey. We have a number of communities in Vancouver. There's communities around the province, up in the north east. We've had some issues around Terrace and Fort St. John that we're also doing outreach in many different ways in those communities as well. So these, we are moving, as the Minister said, into a different time now where vaccine will be much more available to everybody in the next little while. So we will be using all of these strategies. The thing about registering means that we can make sure that you get the information you need as quickly as possible and as efficient as possible. So those are some of the strategies we're using and will continue to use. Oh, yeah. Oh, and we're reaching out.
Yeah, and there's a very significant effort this week in particular across Metro Vancouver in particular, led by the Premier, to reach out to people to encourage them to register, and if they receive an invitation to book. The issue in Surrey is an issue of transmission. It's obviously a very high level of transmission in Surrey. Surrey actually has a higher level of immunization than the city of Vancouver, the city of Burnaby, and other communities in Metro Vancouver, but we need it to be higher, and we need more people to register. There's a very high rate of transmission, as everyone knows. If you've reviewed the local health area data from last week, you'll see that. It's a significant situation in Surrey, and it's why we absolutely encourage everyone in Surrey, but really everyone in Metro Vancouver, to register, and when they're invited to book, but to register this week. And the Premier is leading an effort across communities this week to get that message out to everyone. He'll be joined by community leaders, by mayors, by everyone else reaching out to encourage people to book. We're at a different moment. We've said for a long time that by the end of June, everyone will have their opportunity to be immunized. Back in February and March when we said it, it seemed a long time in the future. We're in May now. It is time. 1.1 million doses of Pfizer this month, doses in the hundreds of thousands of Moderna this month, and even more coming in June. So this is the time. We need everyone to register.
Katie, did you have a follow-up?
Yes, when Dr. Henry mentioned the possibility of shrinking the interval, do we know how soon that decision could be made, especially in light of there's one study out of the UK that found that a single dose of Pfizer may not be enough to protect against the variants. And of course, there's individuals who are going through chemotherapy or who are concerned about the 4-month delay because they're afraid that the one dose does not provide enough protection. So what has influenced the decision to shorten that interval, and how much shorter could it be?
So we've said from the very beginning that the interval was a maximum of 4 months, and it was based on available vaccine. And the strategy that we're using, based on the evidence that we have and the modeling and all of the data that we have, is that it is better for all of us to get more people protected with a single dose than to focus on getting everybody protected with 2 doses, because the incremental benefit for an individual is quite small. And that study in the UK showed this as well. What it showed was that healthcare workers were well protected after a single dose and protected against the variants that were circulating at that time. Which were different than what we're seeing now. That study also showed that people who had an infection prior, so whether it was even an asymptomatic or a mild infection, mounted a stronger antibody response. So the first dose of vaccine really, to them, acted like a booster dose. What we don't know, and what the challenges that the authors of that study brought up is, we don't know if that level of response would be the same for some of the newer strains of the virus that people are being infected with right now. So that's the information that we continue to look at, and how we look at that is by following the vaccine effectiveness over time. So if we start to see breakthrough cases in people because of different variants, for example, because of the virus they're infected with. So that's what we're doing here in BC. The BC CDC has been following very carefully healthcare workers, and we compare healthcare workers who are immunized versus non-immunized and see if we're starting to see breakthrough cases. And so far that has been very small. And also we look at, we've been looking in long-term care homes as well to see in those settings, are we seeing increased numbers of cases in people who, if one of the newer strains of the virus is introduced into those settings. And so far, we continue to see very good protection from a single dose, as they did in the vaccine effectiveness in the UK. So what we are looking at is, once we get every adult to that point where we have high levels of first dose, then we can start to decrease the interval for second doses. So as I said, people who were immunized early on, they're now getting their second dose, and as we go into May, that increases in numbers of people. And for those who were immunized, healthcare workers, people in First Nations communities, where we did a whole of community, we have taken those vaccines off the top for second doses, so you will get them at the very latest by 4 months. But we also know that with the amount of vaccine that we have coming in the next 2 months, many people who received their first dose in the last few months will not have to wait for 4 months. And we are looking at the data of how we do that over the next few weeks. So I know that sounds confusing, but it is exactly what our whole strategy has been about, getting as many people protected as quickly as possible, and particularly moving up the line those who were most at risk. But as we're into this phase and we can open up more vaccines for more people, we'll be able to start the second doses for more people sooner.
Our next question is from Binder Sajan, CTV. Please go ahead.
Hi, Dr. Henry. I'm just wondering, this morning we heard from Nancy who says that those who don't want to wait for an mRNA vaccine should get AstraZeneca, whereas before we've been given advice to get the first vaccine available to us. Can you talk to us about why this advice has changed, and what do you say to people who got AstraZeneca who are now thinking, or maybe second-guessing, getting this shot?
Yeah, so I think NACI has always had the recommendations based on the comparison with the mRNA vaccines, but the advice still stands. With the amount of transmission we are seeing in this province and in this country, then the best advice that I can give and that we, my colleagues across the country give is the first vaccine that you have access to is the one that you should get, and that includes AstraZeneca vaccine. We know that there's this safety signal, and for some people they may want to wait that period of time for could have been several weeks to months at many points in time. But let's be very clear. We have good information, really good data, real-world data from the UK that shows that a single dose of AstraZeneca or Pfizer vaccine provides excellent protection, very high protection, in the high 80% protection against transmission of the virus, but also the serious illness, hospitalizations, and deaths. And more recent studies have shown that both AstraZeneca and Pfizer vaccines prevent you from getting infected yourself and make it less transmissible to your family if you do get infected. So both of those were equally effective vaccines at preventing transmission within families and households, and that's really important. This is great information that helps us understand that both of these vaccines work very well. And so I still encourage everybody to receive the vaccine that is available to you first. And I can say that my family members received the AstraZeneca vaccine, and we will be making sure that you have access to the information you need about second doses of AstraZeneca vaccine when they're available as well.
Binder, did you have a follow-up?
I do. And just actually following up on what you said there, you talked about people who are getting messages when they register with the provincial system if they are at an age where booking is allowed, that they can book their first dose, even though they may have already had their first dose at a pharmacy or workplace. I guess people are wondering, why isn't that data from pharmacies or other places being shared with the provincial system right now? Is there a chance that someone could get missed here? And is there anything that's actually stopping them from booking their 2 shots of Pfizer?
No, there isn't, though I wouldn't recommend it to people. But it is the challenges that we have with building an IT system that allows us to have that ability to match vaccines to populations around the province. So it is a really important, and it's going to be a very helpful legacy system, but we've been building it as we go. So we do have a provincial immunization registry, and that's the basis that every vaccine dose goes into, and that's one we've used for many years, that we have all our childhood immunizations in. You will remember about 2 years ago we came out with a requirement that school-based immunizations be recorded in the provincial registry. So that registry, that's the basis of where every single dose of vaccine gets into that registry, whether it's from a pharmacy, whether it's at one of our clinics, whether you got immunized in a community or in your workplace. They all go into the basic PIR, we call it, the Provincial Immunization Registry. There is now this whole registration and booking process layered on top of that. So the information about every single dose goes into the registry, but it's coming in from different places, and that is all now being moved into one single provincial, supposedly seamless program. But in doing that, and anybody who's worked on these big IT projects knows that there's always glitches and there's things that come up. And so I, for example, have had my first dose, of course, of Pfizer, and got a notification that I was eligible for my first dose because of my age coming up in the past week. And we've recognized that that's a glitch, and they're going to be fixing it. So there's not, we don't believe there's a risk of people being missed. It's the other way around. So pharmacies do report the information into the immunization registry. There can be a delay in that, and that's one of the challenges we have with working with the many pharmacies and the systems that we have. So it is much more likely that people will get in there twice. And that's okay. If you've already had your vaccine, you can ignore that second invitation, and you will get an invitation for your second dose when that's due. The other thing that will allow us, the system will allow us to do as we work out these bugs in the next little while, is when, right now it flags when you're at about 13 weeks so that we can make sure people get booked for their appointment before the 4-month second dose interval. But if and when vaccine becomes available, we can move that up, and the system can notify you that your second dose is now going to be at a shorter interval.
Our next question is from Richard Zussman, Global. Richard, please go ahead.
Dr. Henry, hoping to get an update on whether there's any news that we will be receiving more AstraZeneca, if there's any improved timeline on that, and also on pregnant women. I've received a few notifications that some of them are being told that they are now being fast-tracked in BC for Moderna and Pfizer. Do you know if there's been any updates on whether pregnant women, like other provinces, are being fast-tracked in BC?
Yeah, so I don't have any news on the AstraZeneca, except we've been notified we've been kept informed by the NOC that they are looking to get some more, obviously, to make sure that we can continue the program with that vaccine, and that they expect to have some more, but I don't have anything other than that. And yes, in terms of people who are pregnant, we have been reviewing with the BC Immunization Committee and our public health team. We've been reviewing the data with our perinatal colleagues around the risks here in BC, and they are slightly elevated. We thankfully have very small numbers of pregnant women who've needed to be hospitalized or had received ICU care, but we have reviewed that data and are coming up with our program, and you will hear more about that in the coming days. We want to make sure that the system is able to support people who are pregnant to receive the vaccines as efficiently as possible. I do also want to say that there's more and more information that we are seeing. We saw information from the Society of Obstetrics and Gynecologists, and a really important study out of the U.S. that reaffirms the safety of all of the vaccines that we have available in all stages of pregnancy. So if you are pregnant and eligible for a vaccine, I encourage you to go and be immunized. We also know now that there's good evidence that immunization in women who are breastfeeding means transfer of antibodies to the infant as well. So that's also good news in protection of infants.
Richard, did you have a follow-up?
Yeah, we've seen a major event, Celebration of Light, now canceled for this summer in Vancouver. Can you provide some guidance and clarity to organizers and communities about what they should be doing in terms of setting up these big summer events, PNE, Pride festivals? Like, is the guidance now to cancel them? Why can't we is there a way to give some definitive clarity on what they should be doing with these big major events?
Well, I think I've been trying to give as much clarity as we can. Clearly, there are things we don't know. We have seen that things can change very quickly. We saw that in the last few weeks. What we hope with the program that we are on now, with the amount of vaccine that we have, is that we will be able to have some small outdoor events. I can say there is not likely to be big events of any sort, even outdoors, through this summer and into the fall and winter of next year. But I can see many situations where we could have smaller distance outdoor events this summer with perhaps hundreds of people. We're watching really carefully some of the really cool things they're doing in the UK, where they've had some a concert where people were monitored before and after to see what are the riskiest situations and how will we be able to mitigate those. We're looking at, is there ways that we can do things like that here, recognizing how important some of these festivals and arts events and cultural events that we're missing so much. But there will not be big events where there's lots of crowds of people this summer.
Our next question is from Justine Hunter, Globe and Mail. Please go ahead. Justine, are you there? Okay, we'll move on. Our next question then is for Marcella Bernardo, News 1130. Marcella, please go ahead.
Hi, Dr. Henry and Minister Dix. Thank you for taking my questions today. I was hoping to get you to kind of elaborate a bit more about the concerns about the variant strains possibly being more resistant to the vaccines and why that might be the reason why we need to ramp up the delivery of second doses.
Yeah, so the delivery of second doses is really to try and get the best protection to as many people as possible. And the variants, the people who are infected with variants is only one aspect of that. It's not what's driving these decisions. I think we need to be really careful to not think about variants as some sort of separate entity. It really is about people and people who've been infected with different strains of this virus that have certain properties that make them, right now, one of the biggest things we're seeing is that the strains of the virus that seem to be doing better and spreading better are the ones that are more easily transmissible between people. So that's the B117 and the P1 that we're seeing. And that's what we would expect to see. This virus changes every time it replicates. And when you have a whole lot of people getting sick, it's replicating a lot. And that's why we see a whole bunch of new strains arising in India, in Brazil, where the virus really is multiplying so quickly between people. But the same things that we do to stop transmission work for people who are infected, no matter what strain that you have. And we see that in what we've seen in Whistler, for example, where we know that immunization programs, the program we had to identify and test and find people who were sick with this virus to isolate them, the outbreak control measures that we've taken made a difference, and we've now seen case rates plummet. And that was mostly people who were transmitting and infected with a variant that's P1. So it's not the variant that makes the difference. It's what we are trying to do to reduce transmission. And so far, we've seen that vaccination has been very effective in doing that. So when we see people who have been immunized, who become sick, we prioritize those to make sure that we're not seeing breakthrough more often with one strain of the virus than another. So that's how we're using our whole genome sequencing right now to make sure that we can detect and test anybody who's had a breakthrough case. And we've had about I think last I saw about 1,700 cases in people who have been immunized with either 1 or 2 doses of vaccine. Mostly 1 dose, and after 2 weeks. We know that it takes much longer than that, so that's an overestimate. So we are focusing on making sure we can see if there are transmissions that are leading to the vaccine being less effective. So far, we've not seen that, but we need to continue to monitor that, and that's why it's so important to get that first dose into enough people that we can get that transmission rates down so that we're not seeing more and more different variations increasing. And of course, part of that is reducing the introductions of new strains of the virus into the country, and where things like travel from countries where there's a lot of transmission happening, or from provinces or places where there's a lot of transmission. And that's one of the reasons why we've put in those travel restrictions we have here in the province, so that we don't have people going from areas where there's a lot of transmission and taking a virus to an area where there's not. So this is how we're attacking it, if you will, or attacking the virus here in this province, and that's about using immunization as part of our outbreak control measures, getting all of communities as much as we can immunized, and that's why we're putting the efforts right now on increasing vaccination rates across the Lower Mainland and getting those transmission rates down. That's our best protection to get through this next period, and then we boost everybody's immunization or boost everybody's protection with the second dose.
Marcella, did you have a follow-up?
I did, and you kind of touched on this a bit, so if you could clarify if the delay of the Johnson & Johnson vaccine, how is that going to affect the rollout overall in BC? Because that one is considered the one dose and you're done, and I think some people may be thinking, I'm just going to wait for that. And if you could maybe just explain why that may not be wise.
Well, I think for some people it is a very good option, and we've been in touch with Health Canada. We had a number of calls over the weekend, some of which were dealing with this, and I know Health Canada it really is about one of the components of the vaccine was manufactured in a plant in the U.S. where there was some concerns about the manufacturing processes. So they are following up with that plant and with the FDA in the U.S. to see if those issues have been resolved. And they've also been, Health Canada is doing some quality assurance testing on the lot of the vaccine that has come to Canada. It is a small amount of vaccine in the overall program, so it's not going to change the fact that we have 1.1 million doses of Pfizer coming this month, and that's going to be the basis of the program here. But it is an important vaccine to add to some of the areas that we are trying to address. So some of the populations where it's less easy to find people after 3 months, and we'll be looking at that. I've mentioned a few of the areas that we are looking to focus the limited amount of vaccine that we have. So people in our the temporary farm worker program, where they move around after a period of time, people who are coming to BC for tree planting, for firefighting. So some really important populations where having that single dose give you that long-lasting protection makes a difference. So we are hopeful that we'll receive some of the vaccine either later this week or maybe next week, depending how things go with Health Canada.
Our next question is from Rob Shaw, Check News. Please go ahead.
Oh, hi. I was just wondering if you could put some context around the number of people that are registered. The press release today said 2.1 million British Columbians have registered on the website. Do we know out of how many? I assume it's not the full 4.3 million. And what do we make of that number so far? Is it lower than we were hoping? Is it concerning? And is it raising the potential that we get this extra flood of vaccines and we don't have enough people registered to receive them?
Thanks for the question, Rob. I think if you look at vaccination levels, over 80 and over 70 now, both close to 85%. We've obviously done a good job registering and vaccinating people in those categories. Now is the time when people in their late teens, in their 20s, in their 30s are going to get vaccinated because the vaccines are coming in the next 2 months. So people who have waited to register need to register now. 2.1 million is a good number, but we need it to be significantly higher. So that in the month of June, especially when we start to get more than 300,000 doses of Pfizer a week, that we're getting to everybody. So I think it's good. So far it shows how robust the system is, that it's easy to register. And of course, a number of people haven't registered because they'd already received their vaccine. Think of all the healthcare workers and the people in long-term care had received it at the beginning. So I would say we need to do better. We need people to register, and so that we're booking clinics and filling our clinics every week. Up to now, it hasn't been an issue, Rob, because we've had a limited amount of vaccine. But in the coming weeks, we're going to need more and more people to register. Now, I believe approximately in the smallest categories, which is 18 to 24, more than 100,000, well over 100,000 people have registered. So you can see that people have been registering, but we need people in their 40s, in their 30s, in their 20s to get registered now. And people in their 50s this week, everyone in their 50s by Thursday will be able to not just register but receive their notice to book. So now is the time for everybody to get registered. 2.1 million is good, but we need to register more people so that we're filling all of our clinics in the coming 2 months so that everyone gets their chance to get the vaccine. I would say of approximately those 2.1 million, about 900,000 or so have had their appointment booked. So that means there's more than 1 million now that are looking to get their appointment booked, so they're already registered. But we want to do much better than that in all areas of the province, and particularly, obviously, in Metro Vancouver right now because of levels of transmission.
Rob, did you have a follow-up?
Sure, thanks. Dr. Henry, can you quantify or just maybe give us any indication what significantly earlier than Canada Day might look like in your mind for everyone getting one shot?
I'm thinking about the amount of vaccine that we are supposed to have to come in, and there's increasing amounts of Pfizer in the next little while, and dramatically increased amounts of Moderna if everything goes as planned. So this is my caveat, because we know that there's always glitches. I mean, we were quite prepared to receive Johnson & Johnson this week. We know there's been glitches with Moderna in the past. So my caveat is that we'll get there by July 1st, and I think we're going to have a really great Canada Day this year, but not a big party, just little parties. But I think by the middle of June we should be well on our way. This is going to be a key month. We're in a whole different world now, and we're going to be providing vaccine rapidly to lots more people. Our clinics are ready and able to scale up, and this is where our IT system, our registration system, allows us to make sure we get the right amount of vaccine to each clinic around the province. And you may wonder why we're saying register so much. It just helps us make sure we get enough vaccine to each of the clinics, and we will help people register. And so there's many different ways that we can get people into the clinics as well. But right now, the most efficient way for all of us is to register, to get booked, and then we know exactly how much vaccine we need to send where and how many people we need to have immunizing in different clinics.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Our last question today is from Tanya Fletcher. Please go ahead.
Yes, and if we could get an answer in French for both questions today, that would be greatly appreciated. First of all, Dr. Henry, I think we heard you say that everyone 16 plus in BC will be able to get a first dose before July 1st. So when are people aged 16 and 17 going to be told to register? And when it comes to mixing and matching vaccines, when do you expect a decision on that to be made? Will it be made by the province or based on national guidance?
Okay, so there's a couple of things around 16, 17-year-olds. In some areas, we are immunizing 16 and 17 people who are clinically extremely vulnerable. It just is only one of our vaccines right now is currently licensed for use in down to that age group. So for our main programs, we're going with adults 18 and above. But we also know that Pfizer has completed a study looking at adolescents 12 to 16, and that data has been given to Health Canada, and Health Canada is considering it, and we'll be making a decision on that, we hear, in the next in the coming weeks. So within a week or two, we understand, barring anything unusual, because sometimes there's data delays. So once that becomes, at least one vaccine is available for that younger age group, we need to look at how do we fit that into our system. And that is the work that's being done right now by our BC Immunization Committee and our Public Health Vaccination Committee. So we have started to look at where do we factor in adolescents, and and clearly we want to make sure that we can make sure adolescents are protected before next school year. So there's a whole lot of factors that we're looking at around younger people and vaccines. The other thing we know is that Moderna is also doing a study on children as young as 6 months of age, but that one part of the study, which is the 12 to 16-year age group, has finished enrollment in March, and so we expect that data from that study will be available to Health Canada as well, and we could expect in the coming months to, if things look good, to have Moderna also available for adolescents and teenagers. So that's really good news for us. We know that children generally have milder illness and are less likely to end up in hospital. So that is a factor in terms of where they fit in our age-based program. But over the coming, over this month and into June, we'll be making decisions on where at least adolescents or teenagers will fit into the program and when they will be eligible for vaccination as well. And the second question, I'm sorry, I've forgotten again, was...
So just about the mixing and matching of vaccines, is that going to be a decision made by the province or national guidance, and when?
So it is something that NACI, the National Advisory Committee on Immunization, is following very closely. I think the world is following. The country that was out first was the UK, so they are the ones that did this study, and because they were ahead of everybody else. We have done some vaccine effectiveness here in BC, and Quebec has, and a few others have, but the big mix and match study between AstraZeneca and Pfizer, looking at one first and the other second, and the dose interval is one that we should get information by the end of this month. And yes, NACI will be looking at it, and we'll be looking at it as well here with our BC Immunization Committee and the BC CDC, and making a decision on that and providing advice to people on that as soon as we can. We do expect that it'll be probably late May, early June. And you will do that in French?
I'll do all the answers in French.
Tanya, did you have a follow-up?
Yes, please. Just regarding that last question from Rob, they're talking about the concern that vaccines could potentially outpace registered recipients with all the doses arriving this month. Minister Dix, you said we need that to be significantly higher in regards to the 2.1 million already registered. What if that doesn't increase significantly? Then what's the plan to get everyone vaccinated if they're not going to the website?
That's where we do some of the outreach that we've been doing in different areas, whether it's through workplaces, through community groups, through religious groups, so faith-based groups, the outreach that the Premier started today with a number of community leaders. So we do have many ways of getting people into our immunization programs, and we will be reaching out again in different ways to try and get people in for their immunization as the vaccines become available and the clinic space becomes available as well. And right now we're focusing on ramping up the first responders, school staff, and childcare staff. As more vaccines become available, that percentage that we've devoted to the first responder and worker groups will be increasing as well, and we're going to be able to move that group ahead really quickly in the next few weeks.
I think it's important to note that I think about 15% of the Pfizer and Moderna vaccine coming in this week, or about 50,000 doses a week, will be going to exactly to groups of frontline workers you see in certain communities, such as Surrey, grocery workers, but right now, and in priority, education workers, childcare workers, first responders, and so on. So there's other ways to get vaccine out, but we obviously want more people to register, and more people are registering. We've seen that in the last week, significant increases, but we want it to do more. We don't expect that to be an issue, but we also want to get vaccine into people's arms as expeditiously as possible. So if you're eligible to be, if everyone needs to register now. And as soon as they're eligible, we'll contact you, and it's important to book your appointment. And I think as we see increasing numbers of people do that, we'll be fine, but we really need it done. It's not an optional question, and that's why we're doing so much outreach on that question. But there are other streams to distribute vaccine, and we're doing that as well. En français, je dirais qu'il faut que tout le monde s'enregistre actuellement dans notre programme de vaccination, un peu partout dans la province, surtout dans la région de Vancouver, mais un peu partout dans la province. Jusqu'à maintenant, 41% des gens qui sont éligibles de recevoir le vaccin ont reçu le vaccin, sont vaccinés. 41%, c'est impressionnant en comparaison de ce qu'on a fait avant. Mais pour la prochaine mois, on va avoir un tas de personnes qui vont être vaccinées. Il faut que tout le monde s'enrichisse maintenant. Sur la question de mixer des doses, il y a beaucoup de travail sur le plan international, national et provincial sur cette question. Il y aura un avis du NACI, on pense, bientôt. Et donc, et sur cette question, on va bien entendu suivre la science, mais il y aura sans doute des opportunités de faire cela à l'avenir. The first question? We're there today on questions, mais en français, je pense que oui, juste aux questions des doses, on travaille sur cette question maintenant, bien entendu. La stratégie de faire, de mettre l'importance sur la première dose, je pense que c'est une stratégie qui a marché pour la province. Or, on va considérer toutes les options. Quand il s'agit des personnes, des jeunes personnes, c'est-à-dire de ceux de 16, 14, 12 ans, il y a certaines personnes de 16 et 17 ans qui ont été vaccinées parce qu'ils sont vulnérables, extrêmement vulnérables du point de vue clinique. Et je pense que je pense qu'il y a des études internationales sur la question de Pfizer, la question de Moderna pour des jeunes personnes. Et dès qu'il y a un changement surtout des licences de Health Canada et puis un changement qui est préconisé par le NACI et d'autres, on va pouvoir changer notre direction sur des personnes jeunes dans la province. Donc ça, c'est une possibilité, mais et on se prépare actuellement pour ce changement qui va venir, on pense, assez vite. Merci beaucoup. Thank you very much. We'll see you on Thursday.